Leslie Hervey, interim clerk.
Good afternoon. I'm Commissioner Denise Driehaus.
Jeff Ludo, County Administrator.
Thank you so much, and I'm Stephanie Summerall Dumas, President of the Hamilton County Board of County Commissioners. I want to welcome everyone here. This is our first staff meeting of 2022, and we look forward to servicing the needs of our citizens in Hamilton County in every way that we can. We want to make as many of our citizens very proud of our work as possible, and we're hoping the COVID-19 pandemic would be suppressed. We all were hoping that, maybe even smoldering, but we see now that that did not happen. And so we're still very hopeful that we will, and we know that we will get through this. However, this is clearly not the case. It has risen, and our Health Commissioner, Greg Kesterman, will give us a comprehensive update in just a few minutes. Before I bring Greg forth, I want our citizens to know today I will be presenting a resolution and ask my colleagues to join in declaring a state of emergency in Hamilton County. And after Greg's presentation, I will present the resolution to declare a state of emergency in Hamilton County. And I'll read some of the parts, other parts I will not read, but all the really significant things that our citizens need to know you will hear. And then ask our administrator, Jeff Ludo, to give some brief remarks as it relates to resources that he can allocate for this purpose. So, Greg, if you'd like to come up, our Health Commissioner.
Good afternoon, and thank you very much for having me back. Unfortunately, since my last opportunity to brief this commission, we have seen just a ton of COVID activity within our community, as you just indicated. So looking at Hamilton County as a whole, we have reached an all-time high of active cases within Hamilton County. We have 28,500 active cases of COVID-19, and that is really just what the health department knows about. There are a lot of individuals that are testing, tests not getting reported to the health department, so this is merely a small tip of the iceberg of COVID-19 cases. Unfortunately, also, when you look at a date that I referred to back in December of 2020 when we were at 716 cases, and we talked about how that was a huge mountain and how much improvement we have made. We have more than doubled that, and today we are at 1651 for our cases here in Hamilton County. Clearly, the Omicron variant that we talked about in the end of the year is what has moved across Hamilton County and, quite frankly, the state and the United States. A real quick run through a few slides showing the progression of COVID within our community. You can see kind of the map change colors over time. So this is August, September, October, November, December, and here we are today in January. And you can just see the significance of cases in our county. I've spent some time with my team, and you look at the different zip codes, and it's clearly everywhere. There's no portion of the county that really hasn't been impacted. The entire county has seen a surge in cases with COVID-19. Our reproductive number this morning is at 1.21. For the region, we're at 1.27. The last couple days of cases have been a little bit lower, so that reproductive number kind of comes a little closer to 1. But once again, with that much active COVID in our community, the opportunity to get people sick remains significant. Percent positivity is at an all-time high, so the number of people going to get tests, nearly 1/3 of them are coming back positive in our region. A little bit more than a quarter in Hamilton County proper, but a lot of folks, when they feel sick, they get tested, it's coming back confirming that they do have COVID-19. Probably then the biggest impact, we know we're not getting all the tests reported, we know we're not getting all of the data, but one number that never lies with a pandemic is hospitalizations. Once you need hospital care, there's no other alternative. When you end up in the hospitals, we know that you have COVID because we're testing for you inside of our systems. Today, we're at 958 people within our region's hospitals, 179 in the ICU, and 126 on ventilators. And talking with my hospital partners, they are essentially slowing down procedures on their own because they need to make room for COVID patients. procedures that do not place a patient's immediate health or well-being at risk, nor contribute to the worsening of a serious life-threatening condition are being delayed. And that's being done obviously without a state order at this time. They're doing it on their own to make sure that they have some capacity to provide care. As I talk about hospitalizations, you're going to hear something on the next slide that I've said so many times about the importance of COVID-19 vaccine. And so there's different ways that you can calculate it, but probably the best is when the hospital systems walk through the system and count COVID patients and how many have been vaccinated. On the week ending on January 5th, 2022, so just last week, when they did their snapshot, 97% of the patients with COVID-19 in the hospital had not completed their vaccination series. I know lots of people right now with COVID-19. Lots of them have been vaccinated, but they don't have serious COVID-19. The vaccines are working to keep people out of our hospital systems in a way that we could only hope our vaccines would do. So the number one message that I have said this week, every time I've had a chance to talk to the media or project, is that the vaccines are keeping people out of the hospital. Don't allow for your friend's COVID-19 case to make you believe that the vaccines aren't working. Realize your friend's not in the hospital. And so every chance I get, I continue to project that message. Unfortunately, we do continue to see deaths with COVID-19. We see about, on average, 3 to 4 deaths per day. Obviously, after you make your way through the ICU, the projection that you get out of the ICU alive is about 50%. So not great outcomes there. Looking to the CDC map, we are at a level that we've not yet seen before on this map. We are at 1,567 cases per 100,000, with a percent positivity, as mentioned, at 27.58. And that does fluctuate. This is up just slightly higher than just yesterday. Vaccinations, we continue to make progress at our clinics. Our office is set up at the Board of Elections, and then we go around the county to various locations. We held a clinic on Saturday in Colerain Township, and we have 409 people get their vaccinations, a variety of first, second, and booster shots. So that was exciting to see. If somebody is listening to me today and wants to get a vaccine, I can promise you, you can go to the Board of Elections right now. There is no wait, no appointment necessary, and we are ready to provide you either information or a vaccine. If you're still not sure and you want to just talk to a nurse, please use that as an opportunity. Last couple slides, I'm going to talk about testing. I spent a few minutes last night and then again today before the meeting. There's been a lot of concern that there's a shortage of testing. And just as recently as an hour ago, I was able to find tests all throughout the county, PCR tests that are free if you don't have insurance. So there are appointments available. Test kits are still a little difficult to find. I have not started seeing any kind of great increase of those coming to my office. I know the library has had some, but they go quick. They are available online. I was able to find them on several online sellers without much difficulty, about $18 to $20 per kit, which isn't cheap. We did also hear that the federal government is working to make those free and requiring insurance providers to provide those. The number one message here, though, if you're feeling sick, if you have that cold-like symptom, I would just ask that you stay home. If you feel like you have a cold, you probably have COVID right now. And so if you don't have access to a test, please keep sick at home. Continues to be the number one important message with regards to what you should do if you feel sick. And the last slide, or second to last slide, there are several National Guard sites opening up in Hamilton County. I am aware of 3 at this moment. There's one this one's actually just north of Hamilton County at the Mason Crossroads. We also have one out at Riverbend and UC Health in Clifton. And I believe there's a 4th location coming online. Those locations, you can find more details on testandprotectcincy.com. And then the last slide, I think I showed this a few weeks back at the end of the year. This is flu data updated. Once again, black line is 5-year average, red line is where we're at this year, and then the blue line is where we were at in 2020, 2021. All of those social distancing, all of the mandates for wearing masks had an impact. And so while we feel hopeless at times because of the state of the pandemic, we each as individuals can start wearing that mask, can reduce our footprint around other people, and we can still flatten that curve. I thank you for the opportunity and happy to take any questions.
Thank you so much, Commissioner. If we could go back to the slide that showed all purple as it relates to positive cases. For those who did not see the beginning of the presentation, if you can just, in a couple sentences, you don't have to go all the way back. You can go to that last one, the purple, all purple, and explain. Of course, it says at the top, positive cases over the last 7 days per 100,000, and then you have on the bottom the range. So I just want people to take a minute and look at that. That is self-explanatory of where we are
That's right.
and what we need to do.
Regardless of which community you live in, if you're not taking some precautions, the opportunity to get COVID is extremely high right now in Hamilton County. And so I just continue to encourage the public to make choices that help reduce your opportunity for getting yourself sick, or if you're living with someone with underlying health conditions, the opportunity right now for making them sick is extremely high.
And the determination of where the National Guard would be, how was that decision made?
So the National Guard is working with our hospital systems to try and eliminate some of the stress on the emergency departments. And so they were working to find a private provider that could do the testing. The Guard is only providing humans, so they're not providing the test kits, they're not providing the ability to run insurance, they're not providing any of the surgical masks that are required. And so they found a couple providers, including UC Health, that found locations that were suitable for their organization.
Okay, okay. And lastly, as we look at testing locations, there are numerous ones. The problem now that is coming up that I've received is the ability to get to those testing locations. Fortunately, I was on a Zoom call today, and there is an option for people, and there has been a commitment to provide some transportation for people. So I'm hooking up some groups with that organization. Actually, it's a state organization that is providing transportation to those who need testing. So that'll be one of our good things that we can do for people that want to get tested or vaccinated. Okay, Vice President Reese.
Thank you very much for the presentation. I do have a couple questions. Test kits. You talked a little bit about that. I know we were pushing people to get test kits. Can you, where are we with test kits now? And then there was something I saw, making sure you get the right, because now, you know, this, the black market or whatever, people having test kits. So are we still doing that? Are test kits still coming?
Unfortunately, we are not seeing huge supplies of test kits come to the health department. I received a shipment last week on Tuesday, so about a week ago, of 2,000 test kits. And you may recall right before the Christmas holiday, I gave out in one day 4,000 test kits. And so we are working with the state to try and see additional test kits. I know the library had 5,000 kits this week that they disseminated to their 6 locations. I think folks just need to continue to try each of those locations that offer free test kits, and we'll continue as soon as we get more to push them out to the public. As mentioned during my presentation, if you have the financial means to get them, you can find them online on common online retailers for about $18 a piece, and those are legitimate test kits.
Gotcha. And because we were concerned about this, I had asked, I think, before the holiday, I was over in Covington, and they had a company, and you said it was done by, I guess, by the state, and they had it where you get to drive through, and it was packed over there. And I said, why can't we do something like that? And you were saying that the state was pushing toward these test kits at the time. So do these test kits come from the state?
Yes, all the test kits that I have come from the state, but you'll be happy to know that the 3 National Guard sites that I just mentioned, I believe all 3 are drive-through testing. So people don't have to hop out of their car. They're able to pull up and get tested.
Gotcha. So now we're moving from a test kit model now to a physical model for testing. And I know we had put 1.5 million into testing based on the information that we had at the time that we were going to go with these kits. But now it seems as though we need physical sites. You said the National Guard is working with hospitals, and therefore they are determining locations. The ones that are in the inner city in Cincinnati, I talked to Health Commissioner Moore. Is that through the city's funding, or is that the state funding, the ones that are at Corinthian Baptist Church, and I believe New Prospect Baptist Church also?
So the city health department is utilizing some of their federally qualified health center team. So they already have, I think, 6 or 7 federally qualified clinics throughout Hamilton, or throughout the city of Cincinnati. They're using those team members in addition to some National Guard to help them run those sites. The majority of those sites will be providing, in talking with Commissioner Moore, the at-home test kits. But if somebody is interested, it sounds like they have the capacity or the means to take a sample for a PCR kit, or for a PCR test as well at those locations.
Okay, so they're driving there, then they're going to get a take-home kit versus them doing a rapid test there, right?
Yeah, so the PCR testing is not rapid. It gets sent off to a lab, I believe. That's my understanding. But yes, they have the kits available there as well.
Okay. And then also, can you talk about the mask? Because, we got a lot of people running around with masks. We all are. But now, do we have to get the other type of mask now? I mean, or do these cloths work? Or now we're talking about 2 masks per person? I mean, we're going to be on 3 or 4 masks? I mean, where are we going with these masks?
Yeah, so masks, for whatever reason, have been such a political item throughout the pandemic. The best kind of mask that you can purchase is an N95 mask, and that's what you see if you go into a hospital setting. But I caution that individuals like myself who have beards, there's room for air to escape around the beard. And so an N95, if you were to actually be properly tested to make sure that you purchase the correct N95, you have to shave your beard. So for somebody like myself, if I were in a hospital setting working in an emergency room, I would not be allowed to have a beard because the N95 has to have a tight fit to your face. In addition, each type of N95 is very specific to the face. So when you go to purchase the correct N95 mask, there's different types. So there's a lot of misconception about masks. The best are N95s, like I just mentioned. The next best is truly a surgical mask. They're multiple ply, and they fit tightly against the face, but very closely follows this cloth mask. Now, are they perfect? No. But if I were to sneeze right now with a mask on, or without a mask on, I can guarantee you would see a difference in the amount of particulate that I'm spraying into the air. Same thing when I'm talking. Sometimes when I talk, a little bit of spit comes out of my mouth, and with a mask on, that's not happening, and it's not making the room full of additional virus in the air. And so, for folks that are most concerned, I would recommend wearing a surgical mask, followed potentially by a cloth mask on top of it, so you have several layers of protection. I continued myself to wear my cloth mask in most settings. Unless I'm in a crowded setting, I'll put on the surgical mask. And whenever I have the ability, I'm still trying to stay 6 feet apart from people, trying to social distance as much as possible. My team in meetings, I've encouraged my entire team, even if it's just a one-on-one meeting, to encourage them to go virtual as much as possible. Things like this reduce the opportunity for illness. I can't make somebody sick over Zoom. And so I'm doing that partially to keep my team healthy. I'm doing it partially so I have team members available to continue to work. And I'm encouraging friends and family when they have those opportunities to do it again. The next few weeks are going to be rough because of the amount of virus we have in our community. And the opportunity to make people sick is very high right now.
That's good information about the beard. I didn't know anything about that. My last question is, Lincoln Ware was on, and he was talking about he went to get a test. And I'm bringing this up because a lot of people dealing with this who have health insurance. And I had read something where the state, and I want to make sure it's right because you're on those calls with the governor as well, but is the insurance, he said he went to a place to get his test, and it was a $40 copay. He paid his $40. His insurance paid the $40. But now he's got $100-something, $200-something bill. And I just want to make sure at a time when testing, everybody's rushing now to, they gotta, they've been calling me, but I'm sure others, but they'd call me over weekends and call our office, I need a test. So people are rushing and desperate to get tests. They go get a test that's not one of these sites because they were at a test. And now they're stuck with big bills from the insurance company. Have you been on any calls to deal with these insurance?
So throughout the pandemic, over the last 19 months or 18 months since we've had testing, The standard is really to swipe the insurance card and try and bill the insurance. Traditionally, I don't hear of many instances of the copay, as you just shared. If you get into one of those situations, most of the sites where they offer no-cost testing, you can get tested without showing an insurance card. So if you're concerned, I would recommend you just don't provide insurance, and they'll offer you no-cost testing. The county's Test and Protect program that went away at the end of 2021, that it was that way. So if I presented myself and I shared insurance, they would bill my insurance. But if I walked up to the same site and I said I don't have insurance, you didn't actually even have to provide ID, I don't believe. They would still test you and give you the result.
Thank you. I think that's important. He said, the customer service said there was a lot of people calling because they got $200 bills.
Yeah, I'd be frustrated myself. Yep,
Yep. Okay, thank you.
absolutely.
Thank you, and I just wanted to make a couple comments. As was mentioned earlier, the board did allocate $1.5 million for testing, and that includes all methods of testing, not just test kits, but all methods of testing. And I also want to ensure the community that if at any time we think that that $1.5 million is not enough, that we will adjust that number. So, and then lastly, as it relates to masks, I think the main thing about masks is to keep them on.
Yep.
Because you think, well, if I take it off for a second, to talk, no, it makes no difference. Whenever you pull that mask down or take it off, you're really, you have to think about the people that are around you, not just yourself. So the main thing is wherever you are, do not take it off, So, Commissioner Dreehouse.
Thank you, Commissioner, for being here. What is the yellow piece on that map?
Yeah, I think it's actually just an issue. It's each of those are census tracts. I think that census tract just had an issue when they ran the data, but the entire county is.
I was going to be pretty impressed with
Yeah.
whatever little tiny community that is.
I'm moving there.
I'm familiar with the county, but I'm like, man, oh man, where is that? So, all right, no kudos to them yet. I want to ask you a question. So you've referenced this a few times. We have so much at-home testing. Those results are not, the data doesn't reflect those results because it's not like people are calling in when they test positive at home and saying, oh, by the way, add me to the number. So next time you come here, I suspect you don't have it today, but next time you come, could you help us understand what the impact to the data is of those at-home tests? And like what I don't know if it's a percentage or, how does that impact the data? Because obviously the number of positive tests is higher than what we know because of the at-home testing.
We actually won't have any way to capture that because there's so many private tests and various resources like the mail where I can purchase test kits through online retailers. So we really have no count of how many of those there are in our community. An individual that uses one of the medically observed tests, that result will make it into the system and is reported to the health department. But any of the other at-home test kits that you're doing for yourself will not make it back to the health department. The number one most important thing, though, is that people respond to their result appropriately. So if you get a positive, we want you to stay home. And quite frankly, at this point, the state who's doing the contact tracing for most local health departments, they're not calling you quickly right now because there are so many tests and so many positive cases. So if you have a positive, tell your friends that you've been around, that you're positive, keep yourself at home, and follow that new CDC guidelines to help keep yourself safe and the people around you safe.
Okay, so no real way to determine.
Nope.
Because we've got the city got 2,000, county got 2,000, library got 5,000, so that's 9,000.
And that's just the tip of the iceberg because
Right.
every Walgreens, CVS, Kroger, they all sell them.
And people are buying them online too.
Yep.
So, okay, all right, so, well, ask some whiz kid over at Public Health, because it's just a curiosity to me, because these numbers are so high.
That's
And we
right.
know really, they're not a reflection. I mean, they're really lower than the reality, so, okay, thank you.
Okay, thank you so much for coming.
Thank you.
Madam President, before you leave, I want to ask the administration, we got a $1.5 million, and I know we're doing like a RFP. RFP takes a long time sometimes around here. Is there, I guess, I mean, Commissioner Kesterman's here, and I know Jeff, the administration, what are we doing with the $1.5 million? Are we able to get testing up and going? People, I mean, there's a great need right now. Is this something that we already maybe had going that we can continue going? What can we do? Because we're getting a lot of calls about that.
Yeah, Commissioners, so the contract that we had for testing was funded under the CARES Act, so that had to end at the end of December. So we immediately, actually, at the end of last year, to overlap, put out an RFP to supplement testing using ARP funding, that 1.5 million you talked about. That would be for PCR testing, just like we have done through the Test and Protect sites. That RFP is due back on the 19th, so next week. So once we have that, once we award that, we will then again have sites available using county funding, county-controlled sites that we will then offer PCR testing to people in the community. So the RFP went out last year, so we anticipated this, so we got it out quickly. So in the next week or so, we'll get the results in, and we'll get that program up and running as quick as we can.
Okay, great.
Can I interject, Madam President? Because we've all talked about this PCR testing, which is super important, but the at-home test as well. That was not part of the 1.5, and so it's going to, if we want to do that, and I feel like we all three feel like that's an important second method for people to get tested. You know, I've had some conversations with Greg and with the folks at ODH, because they're the ones getting us the tests, but that's not to say that the county couldn't also buy at-home tests and distribute them perhaps through public health. It's a matter of, are they available and how much would it cost us? And so I have asked ODH to give us their contact information, because it's a local company that's making them. And so I feel like that's probably a good way to go. So we're looking into that too. But the cost is something that we have not pinned down, but that will come back before the board if we go ahead and do something along that route.
Yeah. Thank you. And anything that you need, I mean, we need to know if it's something needed, so then we can make a fast action. I would just call Bernadette Watson called just today. Said, "Where's the drive-in? I need to drive in and get this test." So I just wanted to make sure that sometimes RFPs move a little slower, and just wanted to be able to give the people that call us an ETA on when this thing will be open and ready to go.
Yeah, so we'll keep the board updated on the process there. I'd also say the Test and Protect Cincy site is a great resource, because there are a lot of sites out there that do offer testing. I know we were emailing back and forth last night just on individual efforts to call and check for availability, et cetera. And there, as Commissioner Kesterman mentioned earlier in the presentation, there are places that you can get into for very quick testing. PCR testing, no-cost PCR testing. So you can go to testandprotectcincy.com.
Yep.
And find the listing of all of the addresses, contact information for every site in the region that offers that no-cost PCR testing.
And vaccination.
And
Yeah,
vaccination as well. Right.
And if I may, the 2 weeks really leading up to the end of the year, I'd go to that website, and it really was kind of hard that last 2 weeks, as people were either getting ready to go visit people and they wanted that last-minute test. Truly, this week, I have checked several times, including last night and right before this commission meeting, and there are tests available. Like, I didn't have to look. The first 3 spots that I looked, one east, one north, one west, I was able to find testing, a variety of PCR testing as well as spots to purchase. So those calls probably are still coming in. I'm still getting them myself, but really keep referring people to that website. It's a great resource for finding locations to get tested.
Okay. Thank you.
Yep,
Thank you. Appreciate it.
absolutely.
So Commissioner Kesterman's report just says exactly what our next agenda item is. We already knew that we were in a state of emergency. So we as a board want to make it official. And as leaders, we have the responsibility to make it official, because our people watch us and they want to know where we are with this dilemma and this virus. So therefore, I'm going to read this resolution that's come forward to the board and ask for support. And I'll probably read most of it because it's extremely important. So Hamilton County Board of County Commissioners declaration of state of emergency due to COVID-19. Whereas coronavirus 219, COVID-19, is a respiratory disease that can result in serious illness or death, which is caused by the SARS-CoV-2 virus. That is a new strain of coronavirus that had not been previously identified in humans. And whereas Hamilton County, Ohio, is affected by COVID-19 virus, and it can endanger health, safety, and welfare of persons within the borders of Hamilton County and all over nationally. We know that. Whereas, according to the Center for Disease Control, the Omicron variant is highly contagious and more contagious than previous variants. And whereas, as of January 10th, 2022, Hamilton County has a high level of community transmission and a 25% positivity rate. And whereas, after a review of multiple streams of information and understanding the degree of danger COVID-19 continues to present to our citizens, Stephanie Summerall Dumas, President of the Hamilton County Commission, requested Hamilton County Board of Commissioners to immediately renew and declare a public health state of emergency in Hamilton County and continue COVID-19 comprehensive updates by Hamilton County Public Health during our commission staff meetings. And whereas the Board of Commissioners has determined that it is in the best interest of the county, in consultation with Hamilton County Emergency Management and Homeland Security and Hamilton County Public Health, to take the necessary actions to combat the spread of COVID-19. Now therefore be it resolved that the Board of County Commissioners of Hamilton County, Ohio, declares a state of emergency exists in Hamilton County, and that we hereby invoke and declare that pursuant to Section 5502.21 of the revised code, an emergency exists related to COVID-19 that requires actions to be taken to protect the health, safety, and welfare of the residents of Hamilton County. And this declaration of the state of emergency shall activate the response and recovery aspects of any and all local and interjurisdictional disaster emergency plans, which are applicable to Hamilton County, Ohio, and shall initiate the rendering of aid and assistance thereunder as needed. And we'll have Jeff Aludo, our administrator, talk a little bit more about the resources that can be allocated. Be it further resolved that the Board of County Commissioners, Hamilton County, Ohio, is requesting the Hamilton County Emergency Management Agency to activate the Hamilton County Emergency Operations Center for the duration of the emergency in order to coordinate response efforts. Be it further resolved that Commissioner Denise Driehaus shall communicate efforts of the Hamilton County Commission, Hamilton County Public Health Department, and Hamilton County Emergency Management Agency related to the COVID-19 pandemic through county briefings. And let me just say a little bit about that. When Commissioner Driehaus was the president, she initiated, because it started during her term as president, she initiated the briefings. And in an effort not to have any gaps in services or communication or partnership with other agencies within Hamilton County and also in the Columbus area, I made the decision that it would be a great idea for Commissioner Driehaus to continue her briefings and continue her partnership and connections with those people. Be it further resolved that the state of emergency shall end in 60 days unless renewed by a majority vote of this board. Be it further resolved that the clerk of the board certify copies of this resolution to Jeff Aludo, County Administrator, Health Commissioner Greg Kesterman, Interim Purchasing Director Jill Williams, and Emergency Management Director Nick Crosley. Now, before we move further, I'm going to ask Jeff to make a few comments as it relates to his abilities as administrator.
Thank you, Madam President. So, yeah, just a couple of things on the declaration of emergency, which is, I think, extremely important for a couple of reasons. I don't want to discount what you've already said, and that is just the public messaging aspect of this as well. I think more than anything, getting it into people's heads throughout the community that this is serious and that this is something that we need to take every action we can to prevent the spread of the virus is important. So I don't want to discount that. Administratively, though, there are some things that this does. Number one, it helps us in the future to make sure that when we need reimbursement, if we have the opportunity for reimbursement from FEMA for certain disaster-related expenditures, this makes that process easier, and maybe more importantly, into the point of the discussion that we've had just over the past several minutes. From a purchasing perspective, it takes the threshold for competitive bidding up to $100,000, where it was currently $50,000. So we can stay with competitive price quotes up to $100,000. Again, for matters related specifically to the emergency, we can't just go off and buy, and change and follow that procedure for anything. But if it's related to the emergency, we can purchase based upon price quotes, competitive price quotes, as opposed to a full competitive bidding process. To get at Vice President Reese's comment that sometimes RFPs take a lot longer, et cetera. So if we were, for example, to look into purchasing rapid tests, and there was a significant quantity of them as opposed to going out and doing a formal invitation to bid, we can look at doing a price quote to pull in a certain amount of tests up to that $100,000 threshold, which is incredibly important, enables us to move a lot faster and a lot more nimble.
Thank you.
Thank you.
Madam
And I
President.
want to also reiterate the fact that we're all ambassadors up here and out there. We all, and everyone who's watching has the responsibility to make sure you communicate to your neighbors, your friends, where you work, about how much of an emergency this is. So although I did designate Commissioner Driehaus to do the briefings, we're all responsible for communicating the same message. We have the obligation and the responsibility to do so as commissioners and as residents and also people wherever you're working. Commissioner Reese.
Yes, thank you, Madam President. The reason I have to pull my mask down, we are still working on my microphone, and I want to make sure
heard you
people can
well.
hear me.
But I heard you well with the mask on.
Well, I'm putting it down so that people can hear me. I got response from people that said they couldn't hear me. We have voted on a state of emergency a couple times, and last year I was a member of this board. I had gotten elected. Now, I was not elected in 2020 because I wasn't running for it, but in 2021 I was elected. And there were a lot of things that we were able to also implement as well. And each of us are elected individually. So we all have equal power to speak out on various issues. And so when I saw the earlier draft, it would have, if we would have went with the earlier draft, I would not have been able to bring forward a 513 relief bus because I wouldn't have been able to talk. And I appreciate, Madam President, you making initiatives that you want to make and you select people individually. I just wanted to make sure in this state of emergency, there are some things that I have that I'd like to have included going forward. I want to articulate in the future on any legislation that comes forward, anything that would muzzle me or prohibit me from speaking out after being elected by the people, I will not be supporting. But I'm happy that some changes was made in this that would not prohibit me from speaking out, speaking to the press if necessary, speaking to community groups if necessary, speaking with Commissioner Kestner, which we've talked, because we all are trying to get this message out on something that's deadly. But I see us as having two states of emergencies. We have an emergency as it relates to health, and we have an emergency as it relates to people about to lose their homes, about to be put out of their home for being in a backlog for rental assistance. That's a state of emergency. Gas and electric getting ready to be cut off in the winter, that's a state of emergency. Water being able to be cut off. Mortgage, the mortgage company wants to be paid. Landlords who are small business owners not getting their money. So if I had been asked, I would have liked to put that in the state of emergency. So we have the health, I see two things, testing and backlog. And I would hope that our committee could have a report from the administrator, not a private report that gives to us, but a public report of a 60-day plan, just like we got a 60-day state of emergency, a 60-day plan on how do we get these people in the backlog to pay their mortgage, their rental assistance, their gas and electric within 60 days that have already been approved. We're getting too many people that's been approved and they haven't got it. So it's a balance of both, and I would like to have that added. It can't be added today, but maybe we can put it forward in the future. So I wanted to clear that up, and in this resolution of a state of emergency, it is very important, and I'm glad that you're in this resolution as president. I'm glad that Commissioner Dreehouse's name is in this resolution, but I don't want anybody to pick up a resolution and feel like Commissioner Reese, well, where was she at during this state of emergency? Because I'm right there on the front lines as well and have some ideas as well. So, again, I'm going to support this. Last week, I'm the vice president, I guess, and I was supposed to be an alternate, and I said, well, Commissioner Dreehouse had asked, can she continue, and she wanted to be alternate. I said, no problem, you go ahead. But I want to be clear on the state of emergency, we all will be speaking out, and I'm going to be speaking out. And I don't want anybody to get this resolution and feel as though, well, Dad, they did a state of emergency, and Commissioner Reese wasn't nowhere a part of this. Was she for helping us in a state of emergency? So I'd like the minutes to reflect that Vice President Alicia Reese also will be supportive of this, but also continue to speak out. And if I have an idea, bring forward, because this is serious business. So those are the things I like to have in the minutes, that I'd like us to come back with a 60-day, a plan for 60 days of how we get this funding out to people who've already been approved, at the same time helping with testing and mask and all of the other things that would be necessary. So thank you.
Thank you. Just a couple comments. We need to be transparent as it relates to this resolution. There was ever any desire to get rid of the 513 bus. We know how effective that's been. So just want to make sure that we're telling the truth about what's going on, and that 513 bus is extremely important, and we want to get it moving, and we all agree on that. Secondly, the state of emergency resolution allows us to continue to impact those groups that were mentioned earlier about the water bill, the rent bill, the mortgage bill, all of those things. We've allocated money to that. This state of emergency doesn't stop any of that. It just really enhances it. And then I'm sure a lot of people, when we pass this, will probably not read this. They probably will not go and check it out. They may. But the votes are tabulated, and Leslie Hervey, our clerk, will have that all on record. So I'm sure that all people know that we are if you are not in the forefront, even as a leader or just as someone in an agency, or if you're not in the forefront as it relates to this COVID-19, then we need to check some things. This is very important to everybody. And so the fact that I chose a certain person or a certain commissioner for this responsibility only talks to my leadership of consistency and not wanting to leave any gaps and wanting to continue. When if it's right, why fix it? You know, it's working well. The briefings have gone well. The connections have gone well. The partnerships have gone well. So it's not about me choosing. It's only us agreeing or disagreeing that it's not effective, and then we don't vote on it. So it's not in any way to exclude anybody, but just to go down the path and enhance what we've been doing.
Madam
Commissioner Dreehouse.
Thank you, Madam Commissioner, and thank you for bringing this forward. I think it's really important that we continue to have a state of emergency in effect, especially as it relates to the purchasing power of the administrator, as we've just talked about, home test, and being able to, in the beginning, we were allocating employees to be contact tracers. If you'll recall, that seems like ancient history, but that was another thing that was able to happen under the state of emergency. So I think it's timely, and unfortunately, here we are still needing to do this, but I'm glad you brought it forward. And I also appreciate the support of both commissioners for the continuity with the briefings. Thank you.
Madam
you.
President,
Yes.
I just want to clarify something for the record, because you said, let's be honest. And I just want to make sure you understood that I am honest. Nothing I said I didn't say this prohibited the 513 relief bus. I said if we prohibit from anyone giving ideas, there would have never been a 513 relief bus. Now, I didn't get here to 2021. So my point is, are we saying that because I didn't get here to 2021 that I cannot participate? And I'm saying that, that's why we have elections. That's why we have elections, so that we can have everyone's ideas put forward. So I wanted to clarify that. Commissioner Dreehouse in the briefings, she's been doing the briefings. She hasn't stopped doing the briefings. There was no resolution. I don't think the last one, and she still was doing briefings. That's not the issue. And like I said, last week, I even gave up my alternate vote if she wanted to stay, said, hey, that's the fair thing to do. But I want to just make sure that whenever there's records, because there'll be records 20 years from now on what was done as it relates to the states of emergency, et cetera. And I've also done a lot of work on behalf of the folks of Hamilton County, and a lot of people voted for me. And I want to make sure in the record that 3 commissioners were all doing work as it relates to this. And I wanted to make sure that the original copy we had would have maybe set a tone that's not the right tone, that would have prohibited or potentially muzzled me from being able to put issues forward and speak out. And I certainly don't support anything presented by anybody over my 20 years of being in elected office of muzzling me, because that's disrespectful to the people that voted for me. But that has been changed now and moving forward, but I do want the record to reflect that all 3 of us certainly have to speak up, speak out, and fight this COVID-19 in a united way. Thank you.
Thank you. And so lastly, I'm not going to belabor this. This is too important. People are dying as we speak, and hopefully recovering as we speak. But being a social worker, hearing, your ability to hear is number one for a social worker, which I am. So I specifically wrote down that we would lose the 513 bus if we had the state of emergency, but things have changed. Never any discussion about losing a 513 bus. And so as it relates to record, again, everybody's name would be on the resolution and we move forward. So it's obvious who supported it. Call the question. I make a motion to adopt the resolution for the state of emergency.
Second.
Okay.
Commissioner Summer Dumas?
Yes.
Commissioner Reese?
Yes.
Commissioner Dreehouse?
Yes?
Thank you for your support. Okay, we'll move forward. And we're talking about COVID-19 and what's going on in the community. We have an awesome young lady here from Closing the Health Gap Comprehensive Report, Renee Mahaffey Harris, who is the CEO. Welcome.
Good afternoon and Happy New Year to you all.
Same to you.
I want to first thank each of you, President Dumas, Vice President Reese, Commissioner Dreehouse, Administrator Jeff Ludo, for all of your work and commitment in the times that we are in. We presented to you, because of funding that you made available to us, a report last December that talked about the steps we need to take to mitigate the risks of COVID-19 to the Black and brown communities. As a result of that funding, we've been able to educate both Black and brown residents, provide mental health forums and mental health work groups, as well as information and campaigns on how we work together to save us, how we must save us. That campaign has been able to continue to grow with additional resources that began from you, to be able to involve teens' voices, to involve voices of many residents saying why it was important for them to get the vaccine. We also then thought we need to find out, for those individuals who are not yet vaccinated, why aren't they vaccinated? What do we need to know? What information could we gain that could inform how we create and deliver messages and really work together to make sure, in addition to testing that Commissioner Custerman spoke about, which is so critical to being able to be reactive to the current variant in our community and in our country, but being able to get people vaccinated and boosted is what's going to protect us into the future. So I'm assuming, will I move my slides or?
It should be right there, yeah.
Right here? Okay, great, thank you. So I am joined today by Tracy Sipple, who has led the research that you're going to see here today, and she'll be joining me in presenting. So first, I want to talk about our objectives. So our objectives in actually addressing this wave 2 of responses were to do a couple of things. First, to increase the awareness build the knowledge and expand capacity to mitigate the impact of COVID-19 on vulnerable Black and brown populations in Hamilton County. This research we're going to share with you today, though, specifically focused on the Black community. We wanted to understand the evolving attitudes, the perceptions and barriers regarding the COVID-19 vaccines, and we wanted to update campaign collateral to reflect evolving attitudes about COVID-19 and the vaccine. Our research methodology that we used was very similar to the research methodology we used back in December of 2020, where we both took qualitative and quantitative data, but in this instance, we focused solely on the African American community in Hamilton County. So respondents were recruited via community outreach, in-person flyers and emails, et cetera, and data was collected between the months of August and November of 2021. Our quantitative data had a few limitations because it skewed very heavily female based on the respondents. Our qualitative data capacity was augmented by not only the focus groups, but also key informant interviews with 13 respondents from the quantitative research. So if you look at the survey demographics, we wanted to recruit people from 18 years old to 75 and older, but you'll see that we had a heavy emphasis on 35 to 44-year-olds. And as Commissioner Kesterman can probably attest to, when we looked at the not test results, but the COVID results by demographics, we did see early on in December these higher numbers with ages 25 to 44, and so we over-recruited in that age range. Oops, sorry. So our research results really break down into a couple of areas, and we're going to dig deeper into some of the perceptions that we learned. But I think it's important to see that 53% of the 168 surveyed had received the vaccine, so that's a good thing, but 47% had not. And this percentage is higher.
Something went wrong. Please try again.
Sorry, Siri spoke to me. So, sorry. Oh my goodness, okay. So this percentage is higher than the county, state, and national reported vaccination rates for African Americans as of November 1st, 2021. So what I'm going to now do is turn over this rest of the presentation to Tracy Sipple, and then I'll come back and share our recommendations on what we learned about why the perceptions persist and potentially what we need to do together. Tracy?
And can I ask a question?
Sure.
Just, I'm confused by the information on where you've got the Band-Aid? Yeah, okay. And so in the little box, percentage of African Americans who have received the vaccine, Hamilton County at 30, is the 37 correct?
Yeah, as of the beginning of November the 1st. So this is, so the analysis was done in November, December.
Uh-huh.
So we had to pick a date, if you will. And recall that the data collection was from July through November. So we wanted to make sure it's representative to, and I got that number from county.
I see. So the 53 represents of those surveyed, but the 37 is of the general population? Okay,
Correct.
sorry, I misunderstood. Thank you.
Yeah, it's tiny print.
I got it.
That's not
Thank you.
November
Yeah.
1.
All right, well, Tracy.
Okay, all right, thanks.
So
Honored to be here.
when you
Thanks.
said July to November of 2021, so you didn't go back or anything like that before July?
No, we initiated.
It was
the
just for that set point?
Yes, so
Okay,
we
okay.
wanted to do edited research to capture over time a little bit, to see how, influx of
Sure.
cases and all that jazz. So we wanted to get a decent sample. And honestly, people are tired of talking about COVID-19. So we also
They are,
attempted to talk to Hispanics, and that was quite a challenge. So we did talk to a few, and kind of, the results are very similar, but I didn't feel comfortable enough to include those, but absolutely.
Okay.
Yeah, people are a
Thank
little
you.
tired. And that's one of our challenges that you see in the presentation, in the recommendations. So how do we shift from, how we're communicating with individuals and go from, the masses to small groups?
Thank you.
Sure. So I think, Renee already covered the slide, but, 53%, so that's not exactly representative of the nation, the county, the city, However, for this research, this is what it was. So we did on-the-ground recruiting. We did it in multiple neighborhoods. We did it at functions. So we wanted to make sure we had a representative set of people, right? And we cleaned the data several times, and we feel most comfortable with that 168 to say this is representative of people's thoughts and feelings during that time. I haven't done this in a long time. So what was interesting, we really wanted to capture the information about why. Why aren't people getting vaccinated? So we know from social media all of the things that people saying as to why, but we wanted to really not only understand their first level of understanding of why not, but really why not? And what will it take to get them to move that needle? So, so we will look at the people who are that have not been vaccinated yet. 40% almost are still extremely unlikely. I am adamant, I am not getting this vaccine. We'll go through the whys in a minute. But, it's interesting. So I'm sure, and on a national level, we see this also, right? Not everyone's going to take the vaccine. But these adamant people are going to be very difficult. But the opportunity, I think, is for the neutral, likely, and extremely likely. And we'll go a little bit as to why they, decided to take the vaccine and when they're going to do it soon. It is. I haven't yet, but I intend to. So of the 24% of vaccinated who plan to get vaccinated, you see about 40% saying they're going to do it soon, the 17%. Sorry. So the reasons why they're saying why I'm getting it now, in the next 3 months, I have enough information. A number of the cases are rising, and I want to get a vaccine, or family members have already gotten it. So enough time has gone by to confirm that the vaccine is safe. It's interesting. So the same barriers that we found in December when everything was new, right? Nobody knew anything, are the same barriers that we have today, where people are really trying to figure out what it is they need to do. So one thing I wanted to understand is over time what's happening, right? What's happening where people are, have they evolved or grown at all in their thinking about COVID-19 and the vaccine? So of course, everybody was very hesitant, a lot of uncertainties and questions about the development. Then the vaccine was launched, and is it rushed? Is it still, is it safe or not? Is it something we should do? How does this really affect the impact of how effective is the vaccine? And currently, it's basically unchanged. A lot of information out there. We've done a lot of work in the city, in the county, to bring awareness, and people have this information afforded to them. But still, they are, either on the fence, or that 40% who say, I am not doing this for whatever reason, for no matter what reason you can give me. Okay. So I'm a researcher by trade initially. I'm a mental health counselor now, but and I wanted to make sure we have that qualitative aspect on it to understand a little deeper as to why, not just high level why. So I'm not sure it was big, where people are saying, I just don't know. I just don't know. And so we take, and it's about, of course, I don't trust the government. I don't trust the medical field. The same things we heard in last year when the vaccines were initially introduced. And then some really adamant, I just don't want it, or I need more information. And we also asked this question quantitatively, and we got the same results, really. Long-term effect, which is something you'll see later. I'll keep jumping ahead of myself, but the long-term effect is really something we cannot answer, right? It's something that won't be known for a long time. But we know the efficacy of vaccines that produced the way that this one was. So how do we get people to really understand that would be the challenge. I'm sorry, I apologize, it's so small. I hope your pronouns is easier to read. Doctor recommendations cite more confidence in the vaccine. When people, so you see by that star halfway down, my doctor suggested that I get the vaccine. That's a huge difference. So what does this mean for us? Are doctors no longer, are they having that conversation? How do we make it so that not only are they believed when they're there, but the conversation can really address the specific questions of the resident. And also the idea, that the belief that the properly tested and the vaccine was over time properly tested is a huge difference between unvaccinated and vaccinated folks. Any questions about this slide? I know it's kind of big. And, it's interesting, too. I want to really point out that second from the top, the majority of, not that, the COVID-19 pandemic is largely over. Ugh. So people in green, and I think this will change now that this counts as, this new variant. But, it speaks to people understanding that we are not, and your resolution today is exactly what's needed to let people know that, yes, we are still very much into the pandemic and we're at risk.
If I could just interject.
Yes.
The interpreters are having a difficult problem because I think, yes, the column and then your back is, so maybe if you could come forward and kind of look to the side, they can,
Okay.
because they're saying they can't hear you.
Okay.
Okay.
Maybe I should do this.
No. Oh, no, you're good.
So, I'm sorry.
No, just lift it, yeah. Stay right, yeah. Turn toward us and they can hear it. yeah.
Oh.
Thank you.
Oh, okay. I apologize.
Oh, no, that's okay. You
Okay.
need to get rid of that column, that's what we
Yeah, I
need to
mean,
do.
it's, I didn't even know there was a screen. I was
Yeah.
like, over there. Okay, so distrust remains a barrier. And I love adding consumer quotes in this, or their resident quotes for this, because it's so important that we see the words of people, what they're actually thinking and feeling. So when we, the government can't be trusted. And, okay, so what is the government? It's everybody, as you can see. And a lack of trust is really just history, right? And it's something that we can't erase, but we are getting better at it. But that quote that says, there's histories with American and African Americans. COVID is a part of that history, along with COVID and reproductive health in Black women. And we also know that there are real health disparities today. So that kind of, people know this, and they know that, we have to be a little more diligent than most to be sure that we get the care that we need and we have the information we want, that we need to make decisions with. They were also very adamant in saying that it's not about this one thing. It's not about this or about that. And specifically, it's not just about Tuskegee. It's about a real history of the challenges that African Americans or people of color have faced in the medical field. This was another very interesting finding among the unvaccinated. The thought I'm being manipulated. That you want me to do something I don't want to do, and why? So the suspicions about that. So they refer to about money and why are people trying to deliver that message? And actually, some of our influencers in our campaign has these same questions asked of them, right? Where people are coming up to them at practices for their kids, saying, "Why are you endorsing this vaccine? Well, what are you getting out of it? What is your gain here?" And so again, this is these really deep-rooted why and questions as to where's the money going, who are people, who is benefiting from people getting vaccines besides myself. I'm benefiting, my family, my friends, my community. This is a whole lot of quotes. Again, I think there's so much power, and including actual words of folks. I think I want to read the top one, which is, another attitude that was pretty pervasive among people in the room, in the forums where we did this research, is that, I'm losing work. I can't pay my bills. I can't do what I need to do because, of all of this, if I'm going to get the vaccine and I'm going to get sick anyway, why waste my time and take that risk? So, I think, it's just a testament to people's being a little tired of the pandemic and going through all we have to do in order to stay safe. Yeah, I think I just want to read the top one. So if I'm going to catch COVID-19, what's the point in getting the vaccine? And from what I just went through with COVID, it really wasn't that bad. I could have still worked and had the time and take time off thanks to the CDC. With the vaccine, you won't get as bad, so he knows this, and you won't pass away, but you can still pass it on to other people and get it. So they get the point. It's not compelling enough, obviously. There's too much risk and fear associated with the vaccines among these unvaccinated people. So we look at the effectiveness. People are, less interested in numbers and percentages, and they want an interpersonal exchange. So yada, yada, yada. Yes, you tell me African Americans were a part of the vaccine trials. How many? How many died? Was the differences between the groups of people any different? Just I guess that another layer, another element to help them feel safe. And that's what we've been doing. That's how we have kind of shifted our practices in the field to make sure we get these answers and they have some real materials that speak to these questions. So, of course, things as Russ, FDA, there's not a lot of trust in the FDA that they are really trying to protect the public and the CDC and all the questions. So these are the things that people are asking about. So the point of this, though, is a third of unvaccinated people know that it is effective. They're just concerned about the long-term effects. And people who are unsure are thinking, how they talk about it is that I think I'm going to get it. I'm just not ready yet. I just want to know one more thing. I just want to make it a little bit, I just want to take my time. I need to come to it myself. So most of the unvaccinated qualitative responders, their friends aren't vaccinated either, and they're not having conversations about it. So, I'll reiterate again that the people are wary, right? And so it's going to take a different approach, I think, to get people to really understand why and how urgent this is. And, it makes sense that unvaccinated, 32% of their friends, the majority, are vaccinated, and for the vaccinated people, 69%. So in these circles, people are in their circles talking to each other. It was interesting, too, and also in recruiting, people were like well, why do you want to talk to me about the vaccine? I'm not vaccinated, and they feel judged, honestly. We need to take that stigma out of it, that people are not being judged. You're not a lesser person because you haven't gotten this vaccine yet. It's more about what you do now. More research, heard that several times, and also in the qualitative and in the quantitative document. And more research, they'll say, they give us sources about the same people they say that they don't trust. So really, there's no logic in this. This is a lot of emotion, a lot of a fear and a trepidation about what might happen to me and my family should I make this choice. So we asked, what is necessary? What do you need to hear and or know or to see in order to take this vaccine to be safe? And it's very personal. We couldn't really, aside from their very individual questions, and we can, yes, do overarching, how's it work, and the propensity of different ethnicities getting and dying from it with the vaccine. All those things are but they all asked in a different way and with caveats. So it was very interesting. We just have to really, so I did some basic 5, but it's a very personal thing, way more than it was we found in the December research. So most agreed that part of the proof is involved the effect of the virus specifically on African Americans. And so when I look for this research to say, from trials to deaths to, there's a lot of conflicting informations out there. So what the Health Cap tries to do is to we usually go for the CDC's website recommendations, or Hamilton County's, or something local, or the state. But sometimes there are differences in what people say, which again, so we need some continuity in how we talk about these numbers and how we report them, because a small contradiction brings up more questions, I think, for people. But the questions they have is how many Black people have died from getting the vaccine, how many breakthrough, and this is way before, this is before Omicron, so we know there's a lot of breakthroughs, but before that, this was a big question. How many Black people have taken it, and what kind of side effects is associated with it. In the CDC website, on the CDC website, they're very clear that these percentages are across all ethnicities, and 5,000 African Americans were in the test pilot for the Pfizer vaccine, but that's not enough. What happened to those specific people is the question. They want to get down to it, and I can't find that information. Or I've asked for it, of course, but we haven't gotten to it yet. And what is the effect on reproductive health immediately and long-term? That's a question we can't answer right now. And for people in that, childbearing years 24 to 38, that's a big deal. So, so share longitudinal studies on and show long-term risk. But of course, that's several years away. Households with kids, we wanted to really understand, how about your kids? Or do they get the vaccination? Because, I shouldn't say this publicly, but I don't always get the flu shot, but my kids always get the flu shot. So I wanted to be sure that's not the case in schools too. And so, if you look at, will they do it at all? Will they never do it? Of course, that unvaccinated is skyrocketed, is at 81%. But there are 20 people who said that they will. So likely those are the people who are still open to the idea of it. But that never column is pretty high. The economic impact on the pandemic. So we asked this question before and below on December the 20th, 2020, and you'll see that the percentages are, a little lower than the 12 and 12 now, but now we're facing 24% of these people have seen a 25 or more, 25 or 50% decrease in their income, which is a huge deal. So recommendations, I'll turn it over. Any questions before I turn it over to Renee for our recommendations?
This is intensive, great research, just really helpful. I was looking specifically at likelihood of getting COVID-19 vaccine, like maybe the fourth one down, with the blue and purple and green, yeah. And just wondering, really, the reasons for we need to deal with all of them in the red, but
yes.
From unlikely on down, are the reasons, I guess you could summarize it as more familial issues, hard to say, or
okay.
societal elements, and so emotional elements, and when you talk about reproduction.
Yeah, it's truly a mixed bag.
Yeah,
and it's
yeah.
difficult to tease, and one is not more important than the other.
Exactly. So when you look at follow-up, and that's what I'm thinking, this percentage here of these three boxes, are you guys, you have the names and stuff, are you going to do follow-up as a so it wasn't anything like need and transportation, or I don't know where the testing site
not
is.
at all.
It's so deep, so much deeper than that.
Yeah,
so.
they know where to get it, and it's available. That's not the question. The question is, should I?
Yeah, those are so ingrained
It's really,
philosophies
really
and
ingrained.
understandable, but how do you get to that deep root of what's going on?
Yeah, so the recommendations are coming up, but one thing that really struck out to me is the idea of how do we, and I'm sure the medical community is very tired, right? They have talked about it and asked about it, and the 40% of people who are not likely to get it are probably very adamant why they're not getting it, and they're probably mistreating medical people, right? Perhaps. The fight's not over, though. We really need to find a way for medical professionals to ask this question in a way that's not judgmental to anybody. So maybe the question is something like, do you have any questions about the COVID-19 vaccine? So, and then even where to go for that information, or that they have it now. We are happy to, we've created so many great collateral materials to make sure that there's information out there. So that's one. And two is this, some of our efforts have shifted to more smaller groups now. But we need to be where people are. So not let them come to us, but we go to them, I think, because, people feel judged. I haven't gotten a vaccine yet. I want you telling me why. So how do we make it safe, a safe place for people to have these discussions? So the support groups are another things, an opportunity I think we have. We are part of the county dollars where we did the COVID-19 campaign. Support groups are a part of that. And so that's a place where people are asking real questions too.
Okay.
Yeah, I wish I knew.
So I'll open it up for any questions. Vice President Reese?
Yes, I do have a couple questions. On the, in the research, was there any, did you see any dip or any progress, if you will, in the middle of it? For example, the We Must Save Us campaign is very strong. And did we see any change in numbers or attitude, and especially like the neutral maybe group? Because I know at first it probably was one way because we didn't have all of the information out, but then you guys really kind of pounded. And did you see a change at all?
Well, I think the change that we saw relative to communication was that we had teens that were ready to speak out and say, we're getting the vaccine for these reasons. Many of those reasons may have been because they wanted to have an athletic season. Some of it was because they wanted to be able to be with their family members. We had a huddle, or I guess we had an assembly at one of the high schools. And I thought it was interesting that 2 students said, the reason that I got the vaccine was because I wanted to protect my grandparents, or they live with their grandparents. So it's like, I need to get the vaccine. So we are moving more towards having more voices from the people who have decided to get the vaccine, but equally having those transparent places where we can have that conversation if you haven't gotten the vaccine, so that you can really share, here are my concerns. And so, the recommendations that you see here are really about us continuing to drill down into individual concerns and make it a safe place to have that conversation. Because I think if you can talk about something you're uncomfortable with people that you feel safe with, you're probably a little bit more likely, maybe over time, to be more receptive to the information. And I think when you saw earlier about manipulation, which I thought, when I saw that from the research that they shared, I was like, whoa, this is not good. But it makes some sense, right? Because people always question, like, if you're giving me something, or if you're like really promoting me to do something, like, what's really up here? And so what that tells me is that conversation and behavior change doesn't happen like big. It happens usually more micro. And so we're going to have to do things like the 513 Relief Bus, where people can come together. And maybe they're getting something else, and then while they're there, they're like, oh, okay, well, maybe I can do this too, which I know that we saw in the data. So I think it's going to be like these recommendations where we're making it easy for people to talk in places where they're safe. We're going to have to make sure that messaging comes from the very people who aren't vaccinated, which is what we're doing. We've got to simplify the information so that
I just wanted to make sure
yes.
that Commissioner Dreehouse didn't have any additional questions for the lady, the researcher, but I don't think Commissioner Reese was done before we go to recommendations.
Oh, okay, I'm
Yeah.
sorry.
Did you have any additional?
I did. I wanted to ask about
Researcher.
did we consider deaths? I know we had a press conference with Minister Brian Walker at Walker Funeral Home, and he wanted to get more involved. Do we see, because the deaths were up, did that play any role in our research to say, I just lost my relative, maybe I need to go get vaccinated.
Not for unvaccinated people. What was interesting, well, what was interesting, I can give you an actual example, and I guess this is recorded, so I won't say the person's name. I know a young woman who lost their parent, and their parent was not vaccinated. The young lady was not vaccinated, and she didn't move to get vaccinated because of the loss of losing her mother to COVID. She got the vaccine because she needed to get the vaccine to get a job. But it wasn't the action of losing her mother. So what that tells, I mean, so that's like, that's an emotional loss. And if that doesn't move you to make the decision, you know, so then you have to start asking, like, why? What is that? And so that's why what we're seeing here and sharing with you is the reality, which means we're going to have to do things differently. We're going to have to try different approaches. I think we continue to talk about masking up and all the things that you have to do to protect yourself and your family, but I think these conversations to move the needle on those who are not vaccinated are much more granular. Like, we're really going to have to make it simple. We're going to have to make it so information can be shared in smaller groups where people already are. And that's probably a harder communication strategy, but it's what we need to do.
And then my last question, it seems that the economics plays a major role. First of all, this group of people are already barely making it. And you're saying a 25% drop in income, and most African Americans in these categories are paycheck to paycheck, and the wealth gap and all that we hear about, and you're saying a 25% drop in.
Well, it's 25 plus, so it's, so that slide says something like 25 and then 25 to 50. So we put ranges on it because sorry. We put ranges on it, so there's that 25% and then there's a 25%, or higher than 25%. So really, we're talking about 50% of people. And that's huge, you know? Is it 50, am I saying that right? Let me make sure. Oh, it's 25% of people, so, sorry, and I knew I was wrong, because it's 12. But, so between 25 and 50, 12% said they had an income drop, and then 12% said they had more than a 50% income drop. So that's 24% of people saying they had a significant income drop due to the pandemic.
Thanks.
Wow. Is that it? Oh, that was. Okay, thank you. Commissioner Treehouse.
Yeah, I'm anxious to get to the recommendations, but I do have one question related to the reasons that people talked about getting vaccinated within the next 3 months. I mean, given the time frame of this survey, before Omicron was a thing, I wonder what you think about how any of these responses would be different now than they were when this survey was conducted, whether it is related to, because we're all trying to figure out how to encourage someone to get a vaccine. And is it the messaging, is it validators, is it medical science, is it, I mean, your friends got it. I mean, the peer-to-peer is super important. But is there anything here, just with your knowledge of how this was conducted and where we are right now, that you think would change significantly in any of the data points that you have here?
You know, I'm not sure, because one of the questions, I don't know if I put it in here, because there's a lot of information, I just tried to make it succinct and information you thought would be. But one data point that I clearly remember is when we asked them, how about the variants? Is that having an impact, the rising cases? What's having an impact on your decision? And it really is not. So it's about due diligence. So when we were in the qualitative research, for example, I wear my mask all the time. I'm staying safe, but I'm not getting that vaccine. You know? So it's a huge challenge. And we know it's not just for African Americans. We know there's a lot of people in this country, right, who are, but different reasons. And I think that's the conversation that Renee was speaking to is, what's your reason? Let's talk about that. You know, what information do you need? What sources make sense to you? and have a conversation that really addresses their specific. And, every time they had that, gave me an answer like, oh, because we don't know how safe it is, or I don't know long-term effects. It comes down to fear. I don't want it. I don't know what's going to do to me. I don't trust the people who developed it. We had a very hard year, 2020, and it was chaotic. And that just fed into the crazy, I think, of really trying to understand if if vaccine is an option for me.
One follow-up to that. So given your knowledge base here, I'm really curious to pick your brain. So the fear factor for folks who are concerned about side effects or they're distrustful, and as you said, this traverses many communities. I wonder if, because we just heard from the health commissioner that 97% of the people in the hospitals are unvaccinated, or rather haven't gone through the whole regimen. I wonder, it's curious to me that there's no fear related to that for percentage, or if people are unaware that the fear maybe, about going into the hospital maybe should trump a fear of something else. And so it's curious to me. And I wonder if people, and it's a new statistic, right? I mean, that wasn't the case back when the survey was done. So I wonder if there's more emphasis that needs to be made about the folks, especially that are concerned about the impact of the vaccine, and they don't articulate that they would be concerned about the long-term COVID impact, because we know many people who have long-term COVID, and it's a real concern.
It is.
So it's so interesting to me, and I just,
Yeah,
given the lapse of time and the changing circumstances, what do you think?
Well, I think in their eyes, it hasn't been many changes. We've gone through iterations where hospitalizations were really high and people were dying at alarming rates. And that was a huge question. I had to figure out how to ask it really nicely. Like, why? It's not, really, then they go to the question about, well, how many is this, and how come this, and how many is because of this that they died? Almost doubting that COVID itself is enough for you to get this. So I think that it's a very deep-rooted belief that this is something I can avoid if I'm safe.
Oh, so avoid, if you're not vaccinated, if you wear the mask, then.
If I am safe, if I wear a mask, if I don't hang around a lot of people, if I don't go to parties, then I will be safe.
I see. Thank you.
Sure.
But those same examples you just said about if I remain safe, don't go to parties, that group we're talking about, that 20s to 30s, they do all those things.
Yes, a lot of
But we know
contradictions.
but their character is they don't have any fear. They think they're invincible. They're risk takers, and I'm going to take the risk. And so how do you?
Exactly. And so, again, this is one of the many contradictions in his research to me.
Absolutely.
In the same hour, I heard people, I actually converted one woman. It was a individual session versus a group. We talked to 3 people at a time, and then we talked to a couple individually. And by the end of it, because I kept probing as to why, and she was like, well, okay, maybe. I mean, she was adamant, no, there's no way. So, as those conversations kept going, the conversation was something they had not done before. They have not spent the time to think about their why beyond the knee-jerk reaction of no. It's not for me, I don't trust it. The long-term effects, I don't know.
Thank you. Thank you so much. We'll move to the recommendations and some solutions.
We do know that the recommendations won't be easy, right? So again, keep the conversation going, but in smaller groups. I'm not going to read all of that because you have that. While not knowing enough about the vaccine as a primary barrier, unvaccinated African Americans are not conducting their own research. The conversation has to be on their terms. So again, meeting people where they are, having those conversations in settings that are a setting you're already in, be it a barber shop, be it an eating establishment, but making it a simple conversation that you're having, and you're making it in a safe place and a trusted place. Simplify the explanation of how the vaccine was developed and approved is important to all the respondents. So, making the information plain and clear in language that people can understand. Is it enough to say the vaccine's safe? I think we've already said that that's not enough. Unvaccinated respondents wanted to be assured with the facts they are unwilling to seek out themselves, which seems to derive from apprehension and fear. The long-term effects of the vaccine is knowledge they want most. But that question cannot be answered for several years, right? So we know that. But what we can speak to are the rates of death. We can speak to the impact to your children and your family. It will be important to seek out alternative data sets that will speak to the potential long-term effect of the vaccine. So we're going to have to look at some of the data sets and say, how do we talk about the long-term impact? Maybe we talk about it from an economic perspective, versus talking about it from the perspective of, do you have COVID? Or have you had COVID? Or are you vaccinated or unvaccinated? And really talk about some of the real-life issues that people deal with and what that impact will be if we don't have more people vaccinated. And it seems skeptics will be skeptical. We know that. When it comes to the 39% who are adamant about not getting the vaccine, unvaccinated respondents want vaccine promoters to tell them the cost, the benefit of being vaccinated, and why they personally got vaccinated, which is really the development that we're moving towards and have been. We find it to be much more effective when someone can share their own story, right? Even if they had COVID. So we're going to be having a town hall on the 19th of this month where we're going to have a couple of people who got COVID, who were in that demographic of 30 to 44. And they really never, they thought, okay, you might get COVID, but they had a really, really very scary experience with COVID, and they want to now talk about that experience. And I think it's those type of conversations where someone can say, here's how I was impacted, and I didn't expect that. So that's what's next, right? Just to bring those conversations more near and dear, more personal. And we look forward to continuing to do that through the We Must Save Us campaign and continuing to work with each of you to make sure that people understand the information easily and can apply it to their daily lives. So I thank you so much for giving us the opportunity to speak today.
Yeah, thank you so much for the presentation. Just an awesome presentation of your work, both of you in the community, and what your staff is doing and continue to do. And as you were saying, we have to keep the lines of communication. I totally agree that the real stories will have a major impact. I just think, and I have some young people that are around me that really I have a great relationship with. I even told them, I said, if you'll get the vaccination, I'll get on my knees and beg you to do it. They said, well, I don't want you to get on your knees, so I'm going to go do it. But they didn't do it. And I know that we have a positive relationship. So it's really critical that they hear, like you say, about people that have gone through it. And I certainly appreciate all this information that was brought forth. Vice President Reese.
Yes, I just want to thank Renee and Tracy and the entire Closing the Health Gap. When this first hit, everybody was scrambling, trying to figure out what to do, and you came up with We Must Save Us. And I think that it is even more authentic today, because what we're seeing there is that people have to make a personal decision on trying to save themselves and saving themselves from, as it relates to their health and their economics, the two. I don't think there's been a time, at least not in my lifetime, in history where we got hit with both at the same time. We might hit with one, but then the other's good, but be hit with economics and health at the same time. And it got down to every level. I remember a barber saying when the governor shut down the state, and he had put on Facebook, he said, I'm self-made. I'm an entrepreneur. How is somebody going to tell me to shut down my business? And I had to remind him that you are regulated by the state, called State Board of Cosmetology and State Board of Barber. And he said, oh, I had no idea. And at that time, he didn't even know who the elected officials were. But every day at 2 o'clock, everybody was at the TV tube, understanding how important government plays a role. And so he had a learning experience, but he was more concerned about, wait a minute, you know, barber and beauty shops never get affected in some of these type of things. Maybe trickle down from a customer standpoint, but the direct effect. So I think that that's definitely the concept for the 513 relief bus. What makes it unique, and I don't think anywhere that I could see in the country has it like this. Hampton had the model of getting the vaccine out. And I got a chance to fly down there and see it in Virginia. But what they didn't have was the economic piece with it. And when we go out, we've got the economics and the health piece. And I saw people say, well, you got your rent paid, but, oh, it's all right here, let me go ahead. Or I've seen people have, you know, they've had 2-hour conversations and the person finally said, well, yeah, I think I'll go ahead with it. So you're absolutely right. We've got to meet people where they are. And, you know, what is it that will get their attention? So you're doing the very, very hard work, and you're getting the hard to serve. These aren't the people that are just looking for vaccine. These are people that you got to really talk to. And they got some good questions. The side effects, that's a good question. And we have to have those entities be able to put that out. What is the side effect? I mean, every medicine has a side effect. I mean, when you get a prescription. What is the side effect so people really know, and what is the benefits? And then the other thing I do want to highlight today, while we are focusing on the African American and the Hispanic community, and even with that, we have a language barrier in some regards. It is a trust issue. And so I appreciate the gap, filling in the gap on those issues. But let me just be clear, it's not just African Americans that has hesitancy. There has been protests up at the State House, and they had horses in the middle of the street, and it's all over the country. It's in the suburb and the inner city. So it's not just one group of people who, you know, have hesitations. But we also must fight misinformation. And we are in a society now where people say, I'm going to Google it myself. Don't tell me something, I'm going to Google it. And it's a lot of stuff out there. Some is true, some's not true. So we also are fighting that as well. So just want again to thank you all for the partnership and the work that you're doing out in the community. And thank you for also supporting the 513 relief bus, but also just knowing the people who are watching, this is not just one group of people. There are a lot of people of different ages. There's some senior citizens, so they ain't taking the shot. So we have a lot of work to do, and that's why we got to all work together. So thank you.
Yes, thank you. Thank you, Vice
Thank you.
President Reese.
Commissioner Dreehouse.
Yeah, just to pile on, thanks for your partnership. It's been an ongoing slog with you all and others. And so, you know, this information is so valuable because it really does help inform how we create policy related to COVID-19. So thanks so much for the research. I'll be interested in, you know, our partnership moving forward and how we can help fold in to what you guys are learning and what you know, and how then we as a county respond. So thanks for being here, and thanks for the info.
Thank you so much.
Thank you. Thank you all. Thank you very much.
So we'll move.
A lot of work yet to do.
Yes. Our next item on the agenda, we have a resolution, but we have Steve Johns who is here to talk about before we get to the resolution.
Thank you, Madam President. I'm back in front of you. You might recall that on November 30th, we were here to kick off this adoption of the 2022 action plan for our HUD programs, and that was the day Emily Carnahan was having her last day, if you recall that. I really appreciate the opportunity to be here to talk about these programs, because I think sometimes we get caught up in the acronyms and the dollar figures, but there is a story behind all these programs. And in fact, this does help us meet our HUD requirements. So those two things are critical when we think about these programs. So first, to the people, you know, I'm relatively new to these programs. Part of my job as assistant director is to oversee the community development division. And so I got to see one of the invoices come through. And it was about just some of the issues you were talking about in the earlier presentations, about 4 people who were saved from eviction by some of these programs. So it really put a name to these programs. So I think that's important. And then there's all the people that administer the program. So really hats off to folks like Claire Meyer and Kyle Snyder, our program managers in the Community Development Division, and our financial suite, Ann Jurgens and Becky Stratton, also play an incredible role. And as you might know, we are a bit understaffed, so all four of those folks are doing a little bit extra until we get staffed up. And that's the last piece on the people part of all these regulations. We are making some new hires. We actually will have a new program manager start on the 20th. Her name is LaCarla Lawrence, and we do have an offer out to a new community development administrator. So soon we'll be starting to fill in some of those gaps. And then to the timeline, I mentioned that we came before you for the first part of this in November 30th, and then the comment period ran through January 5th. No comments were received, even though we did notice in the Herald and the Inquirer. That is fairly typical for this annual plan adoption. We do get a little bit more public input in our 5-year plan that we do that sets up the stage for these 1 years, but often don't get much input from the public on these particular 1-year plans. And here we are today to present this plan, this action plan for approval, so we can submit it to HUD by the 15th. And the period of this runs from March 1st of this year to February 28th, 23. And then a bunch of slides that are just a quick reminder about the dollar figures and some of the pieces of these CDBG and HUD grants. So the first one is the big CDBG piece, which is about $3.5 million a year. Then we have the home piece, which is $1.5 million a year, and that's more for affordable housing type programs. And then finally, the Emergency Solutions Grant that is administered by the Continuum of Care. Quick reminder about where these programs apply. Not in the city of Cincinnati. The city of Cincinnati has its own allocation, so our programs do not impact them, except in some very rare circumstances. And then pretty much across the rest of the county, except for 4 jurisdictions. So all those in the shaded lime color are eligible for these programs. And how do we decide on how to spend some of this money? Well, we have a great advisory board that helps weigh in on these matters. It's made up of social service agency representatives, local government representatives, and other professionals. We have 3-year terms, and there's currently 1 opening on that advisory board. And then we take the CDBG money and that $3.5 million and divide it into different pots. About $1.5 million go to community-specific projects, so projects that the jurisdictions themselves want and help work with us on. And then countywide programs that have larger scope, including some of our nonprofit services and other economic development work. And then, of course, it takes people and resources to manage these programs, so we have about $500,000 for administration. These community-specific projects happen in 3-year buckets. So here's an example of how the city of Cheviot spent its money that they were allocated for about a little over $500,000 for these 3 years that are covered in this group of award. And they've decided to use a large piece of that for what they're calling the Harrison Avenue Road Diet. So about $250,000 to make that road more pedestrian friendly and help people get across it, and also to beautify that road. Here's a project in Delhi Township where they used some of their CDBG dollars. This was a $150,000 project to do some playground equipment. Mini planning grants are the piece that I'm more familiar with. They came from the community planning side of our shop, helped the community development division on these. And this is where we allocate $100,000 to set the stage for these great projects. And so we award between about $20,000 to $40,000 per project, and they help do some of the pre-planning to identify great projects for the future. Here's a sample in Lincoln Heights, a little rendering we've done up at near Dorothy Court and Mangum Drive. As you might know, there was a lot of work done on the interstate up there on I-75, and they moved some ramps around, and now there's some ODOT property that you could do a gateway facility like this in Lincoln Heights. Also to plant a bunch more trees in there, do some streetscapes, And so this is, again, setting the stage for a bigger project, an implementation project that might help the village. We also have the Community Economic Development Assistance Program. So this is for bigger projects where we acquire property or do demolition a lot of times, up to $300,000 for these projects. And that process includes another advisory group that's made up of a combination of HCDC staff and the CDAC representatives. I really like this one in Delhi Township, which was awarded some additional money. They're doing a mixed-use center that includes a new pool, public pool, indoor pool that the high school would use. I think it's got a preschool that the school district's going to run there, about 250 apartments. And this really connects the dots, right? We did one of those mini grants on Delhi Pike, and then it led to this investment of $300,000 to just take down the old Biggs that was there, if you might recall, on Delhi Pike. And now we've got a $60 million investment on that site that is going to come through our building division. So that's touching a lot of spots in our county and how we can help facilitate something like that happening. Nonprofit service, we do a RFP for that every year. And some examples of what we did in years past, Women Helping Women, Cincy Smiles, Legal Aid Society, and the Free Store Food Bank are just a couple of the places that we've been able to award money last year. And quickly, the home budget is that $1.5 million that I talked about. About 10% of that goes to administration, and then the rest goes to housing projects, including some of these housing plans. We've done 5. We did 5 last year, I should say: Addison, Cheviot, Deer Park, Norwood, and Silverton. And we've got 3 more scheduled here in 2022 in Gulf Manor, Lincoln Heights, and Forest Park. And we do the affordable housing RFP. These are the actual projects that we do that actually help construct affordable housing throughout the county, including this project in the city of Cincinnati, Logan Towers, a recent project that was funded with home money. And finally, the ESG budget, about $300,000. This is mostly for homeless services, and again, mostly a pass-through from the county to the continuum of care. And with that, I'd be happy to try to answer any questions.
Thank you so much, and I know we want to get this in before the 17th. Our deadline is the 17th. We're certainly hoping that we will support this. This is a great project, and I was looking at your map, and you said there were 4 jurisdictions that don't qualify in Hamilton County, and I can remember when I first looked at the map, when I first came, there were many more than 4, and you guys are working very hard to see if those 4 might be interested. So it's just good to see that. So I don't have any additional comments or questions, but I'll open it up. Vice President Reeves.
Thank you for the presentation, and this is very important. I got 2 things I wanted to make sure, and I just want to put it out there again. As we are looking at affordable housing, $40 million, I know we're using $5 million to help people right now who have homes. We want to keep them in the homes if they need help with property taxes and those kind of things. We got $5 million, so that leaves us $35 million. And then we've got the CDBG dollars. Obviously, that does have some other strings with HUD. But as we look at it, I just want to make sure that we continue, or not continue, that we look at it holistically. And one of the things I asked for when I first got here was that we would have an interactive map of Hamilton County documenting where the affordable or workforce housing is. So when we know we say yes to this, it helps over here, but it also helps over there. Or maybe if we say this, we're going to unintentionally do something that we don't want to do, but maybe looking at all of our dollars in an overlay. That's something that I really would like. We have a great opportunity with the dollars now, but really looking at that. So it's not CDBG, we do action plan over here, but then over here we got another group planning over there. We may already have been put together, but I can't wait until we're able to see an interactive map, and people that are at home can look at it. It's interactive. You can hit here, hit there. You know, with Google Maps now, you can do everything to show the impact that we're doing, because we're doing a lot of great things, but maybe you don't see the impact because it's a one-off here and a one-off there and a one-off here. The second thing that I wanted to bring up was that you said we don't do the city of Cincinnati, which I understand, but then, can you explain that Logan project? Because you said something is that in the city, or where is that?
That's correct. The Logan project, there are regulations in the home dollars that allow, if the city of Cincinnati puts in money first, we can also contribute to the project. So that is one of those kind of exceptions to the general rule, but is in the home regulations to allow for that.
Okay, well, that's good. I mean, again, when we're looking at, the city of Cincinnati is in Hamilton County. It's one Hamilton County, so when we look at that also, whatever they're doing, and we're able to, like you said, a Logan-type project, then again, we would be able to see this on a interactive Google Maps style thing, so that when someone asks, what are you doing with affordable housing? What are you doing with workforce housing? This interactive map could come up and show what we're doing across the whole county. But anyway, this is great. Look forward to supporting it.
Thank you. Commissioner Dreehouse.
Thank you. Thank you for the presentation. Yeah, I don't have any questions either. I'm looking forward to supporting this as well. There's a lot of information in here, a lot of different programs that you referenced. Just one quick thing. We have in the past allocated dollars for people that are, it's a lot of elderly folks that need some home repair done to their homes in order to stay in their homes. Is that incorporated in one of these pots?
Yes, I think we're continuing on with the HVAC services that are open right now that we're using 2021 dollars for. That's included in this round. We continue to look for ways to either enhance or find better delivery methods for that, but that is a program that has continued to be in here for years.
And if people, I know it's fluctuated just a little bit, so if people need that kind of assistance, they call?
The Community Development Department, yes.
Okay, yeah, they call directly to the county for that.
That's
Yeah.
correct.
Okay.
If they're in those participating jurisdictions, that is the caveat. And the city of Cincinnati has its own program, so sometimes there is a bit of confusion about that. We serve those jurisdictions that were shown in the mint or the lime color there.
Yeah, okay. All right, great, thank you.
Can I follow up on that point? Is there any way, as someone with an entrepreneurship and a marketing background, is there any way we could market that? I know we put $1 million in our budget for a new pot of $1 million for seniors to help them with those kind of things, as well as other utilities. But I was just thinking if it was someplace, our 513relief.org is doing great, maybe someplace and some phone number. So I would say 3 things. A place on our website that's seniors specific and has what you got, has a phone number that people can also call for if you're a senior and you need help with because we get people, the furnace and all those kind of things. And then a third piece, if there is some marketing available that we can market to the seniors so they know here's a 1 number, here's a 1 place to go if you need help with X, Y, and Z. Because I know we also have gotten calls, and I just didn't know where to send them. But I think with what we're doing with seniors, it kind of pops it out, even though we're doing a lot of things that puts it under one umbrella to the outside public.
Madam President, Commissioner Reese, a one-stop shop would be great. I think we spend a lot of time kind of pointing people in different directions to say, oh, no, not quite, you don't quite qualify for this one, but over here, you have to call that. And a lot of times we're dealing with people that don't even have computer access, so they're often having to go to the library and fax something over here, and it really is something that could be, there's a better service to our community somehow.
Thank you.
Thank you. Logan Towers, is that in Price Hill? Where is that located?
I believe that's by Finley Market,
Finley Market, okay.
so in Over the Rhine.
Okay, thank you. Okay, with no discussion coming forward, I'd like to make a motion to adopt item number 4.
Second.
Commissioner Summer Dumas,
Yes,
Commissioner Reese.
Yes.
Commissioner Dreehouse.
Yes?
thank you so much. We'll move forward. I'd like to take 5 and 6 in one motion if I could. It's a resolution appointing a member to Hamilton County Developmental Disability Services Board. We have Miss Leisha Marie Thrower, and we also have Miss Ferosa Faruqi. And I make a motion to appoint them to the Hamilton County Developmental Disabilities Board.
Madam President, I'm going to second this motion, but I just want to know, is there a reason for a address, one lady's address is in here? Is there, if not, if it's, and the other one is not an address? Can we, I don't know if they want. No, but do you want their address out there to the public? I guess is my question.
Usually their addresses are
Oh,
on the
Are public.
resolution, and I
Yeah.
send them a copy of the resolution.
Talk in the microphone if you could.
Usually the addresses are on the resolution, and I send them a copy of the resolution after the meeting.
Okay,
well, it needs to be added to the second person as well, so.
okay, we can make
I-
it a,
Yeah, I just wanted to make that correction,
Okay.
but I second the motion.
okay, thank you.
Uh,
Does that mean-
Commissioner Summer Dumas,
Yes,
Commissioner Reese.
Yes.
Commissioner Dreehouse.
Yes?
we'll make that change. Thank you so much. At this point, I'd like to make a motion to adjourn.
Second.
Commissioner Summer Dumas.
Yes.
Commissioner Reese.
Yes.
Commissioner Dreehouse.
Yes?